Hi, thanks for the chance of the task force to listen to the community today, especially here in El Paso County, because sometimes it feels like you don't see us. I don't know. Often you do, but I think we want to be a little bit more noisy, so this is a good opportunity to do that. I'm Shawna Kemppainen. I'm the executive director of The Place, where we support youth who are experiencing homelessness to create bold, quantifiable change in their own futures. And I'm here to convey some of the challenges that we hear directly from youth and that we see working directly with the nearly 600 youth a year we work with in El Paso County. This is our 20th year as the runaway and homeless youth provider here in El Paso County. And we're unique because we're the only state licensed youth shelter in this community. Of those 600 young people that we worked with last year, we work with them age 15 to 24 through a shelter program, housing, a street outreach team, also wrapping around them with employment and education, health services, and we're super glad to say a big advance in the last 3 years. Now 77 youth are out in our housing programs, much thanks to the state of Colorado. In our community, we need more ability to help youth where they are and move forward in the way that they want to. We want them to feel really empowered in all of this work. The most recent data out of the University of Chicago Chapin Hall study says that in the United States now 1 in 10 young people between 18 and 24 are going to experience homelessness this year. And that is right here in the United States. Youth homelessness in our community is also growing. On average, in a month's time in El Paso County, some 140 young people have asked for service providers to give them help with housing and other services. 1 in 3 of those youth are sleeping outside or somewhere else that's not really meant to be a place to sleep. Nearly half of those youth are staying in shelters, some of them in the adult shelters which do their best, and we appreciate them, but they'll be the first to tell you they're not equipped to deal with young people, so they refer them to us. And some of those youth are couch surfing, not knowing where they're going to be in the next week or two. With more than 2,000 young people in El Paso County public schools experiencing homelessness, we could fill a whole high school campus easily, just in this community. Our data at The Place that we just crunched through from last year shows that 7 out of 10 of the young people we're working with are identifying mental health issues as the key to the reason they became homeless, and also as a major thing that's preventing them from getting out of homelessness. I'm going to tell you a little bit more about an action that we're taking around that. And I want to let you know a little bit about the expanded need that we see. While expanding access to healthcare has been a priority, and I think there's been some advance in that, for homeless youth who need support with severe mental health issues or substance use disorders, we must have more places, more people, more of the right, well-trained kind of people to ensure that their transitions, especially out of systems like the juvenile justice system, child welfare, or behavioral health centers themselves, become a true bridge to stability. In our community, we need to get youth the access to behavioral health support when and where they need it, when they ask for it. We need to improve the transparency and transition planning process and ensure it's youth-centered. And that includes housing stability, because that's such an important piece of maintaining someone's mental health, as I'm sure most of you are aware. We have to make sure also that there's plenty of support as these youth practice adulting skills. I still need support in my adulting skills. Young people still need that support as well. And we want to make sure that during their stays in shelters and transitional housing, they have access to that kind of support. Another key thing we can do, this is across the nation, not just here in El Paso County, but we need to improve family engagement and education when it's appropriate to support LGBTIQ youth, who make up about 1/3 of youth entering homelessness in our community and across the country. We also have to examine our systems through a trauma-informed care lens and a racial equity lens, because youth of color are now making up about half of the youth who are in homelessness, and we're glad to say that it's about half the youth who are also getting into our housing programs. We also need more housing units specifically available to youth exiting homelessness. So I say all of these as a piece that really rides along any sort of mental health care. If I can tell you about one thing that we're doing at the place in particular that might be of interest, and we can do more of this. So we have now created a partnership with Peak Vista Community Health Centers here locally, and with Urban Peak in Denver and the State Office of Behavioral Health, to embed mental health clinicians into our street outreach team and other programs, so youth can access quickly the trauma-informed, effective sort of professional support that they need. The project is called Healthy Transitions, and it is supported by a federal SAMHSA grant. The therapists are present for the youth through normal day-to-day activities, by working in street outreach. So youth get to know them just as a person, just as another team at the place. Eric's that cool guy who burns the bacon. Oh wow, he's also a therapist, I can talk to him. That removes a lot of barriers for youth actually seeking the help that they need. Those therapists also are really excited to be in that environment where they're not having to wait in an office where someone may or may not be able to show up because they may or may not have transportation. Finally and foremost, I would recommend that this task force also consider the statements and voices of youth themselves. I'm sure that you already have. And I would recommend that you take a look at the Coalition for Juvenile Justice, who worked with Colorado youth and heard 15 of the most common recommendations to prevent youth homelessness and improve mental health related to the juvenile justice system. I'll send that information to you, glad to do that. I appreciate the chance to be able to talk today. Thank you.